Without further ado, let me introduce Senator Frist. Senator Frist is a remarkable story. I've had the pleasure now of working with Senator Frist as a board member at Accolade for the last 5.5 years. But when you look back on his story, and you'll hear about his father who was a primary care physician, that this is a man who grew up in the state of Tennessee, went to Princeton, went to Harvard Medical School, and from there became one of the pioneering physicians around the idea of heart and lung transplants, performed over 150 heart and lung transplants. And you would think that that someone who had been through, that had achieved all of that might be done with their career. And really at some level, Senator Frist was just getting started. He went from there to becoming a senator from the state of Tennessee. And not just a senator, but the Senate Majority Leader, serving 6 years with President Bush and 6 years with President Clinton. And uniquely, a senator who decided when he came into office that he was going to serve 2 terms and no more, and honored that commitment and moved on afterwards. And you would think, okay, well, he's a cardiovascular surgeon and he was now the Senate Majority Leader. He must be done now. And instead, he actually founded one of the most successful venture/equity firms in all of healthcare and healthcare investing. Beyond all of that, he is an extraordinarily fine human being and somebody that we're all really, really lucky to work with. He's on the board of countless institutions, ranging from the Robert Wood Johnson Foundation to this spectacular company called Accolade that you guys all know and love. Senator Frist, thank you very much for being here, sir.
Good, Raj. Thanks. It's great, really, really, really great to be with you and with the Accolade family in an informal way where we can interact and talk a little bit about leadership and a little bit about the past and where we are today and where we're going. But thanks a million.
Senator Frist actually has more seniority at Accolade than I do. He's been on the board for 10 years, I think, at least, or so thereabouts, and I've only been here for 5.5 years. I have the pleasure of knowing some of this story, Senator, but I think one of the most fun parts of these sessions is people understanding your roots, where you came from and why you've ended up here and why you've been so ambitious in terms of your pursuit of all these objectives over the course of the stages of your career. Maybe if you wouldn't mind taking us back to your early days and sort of the foundational elements of what led you on this path.
Yeah, Raj, and I do attribute most of my interest that seemed when I just listened to you, even I said, this guy's crazy. He's all over the place and there's no real focus to it. But in truth, there's this little line, this narrative that does go through my career and will continue to go through my career that does go back to my really early years. And it's been manifested in different ways since then, but grew up here in Nashville, Tennessee, where I am now. And I've left for 10 years, come back for 10 years, left for 10 years, come back for 10 years, left for 10 years, come back, just back and forth. But do have really deep roots here in Middle Tennessee and affected by that culture and in many good ways and some not so good ways. But the big story is that I was born the last of 5 children in a family. My dad was a physician, a primary care physician, and ultimately when the field of cardiology came along, became a cardiologist. So I grew up watching brothers and sisters, watching the things they did and the mistakes they made and the good things that they did. And that had an impact. But the impact on having a father and a mother, very compassionate. Dad was probably much more conservative, probably Republican, mom a Democrat, and more progressive in many ways, and that's borne out. But then would go on rounds with Dad, and it was true house calls, and it was walking into a room with a dark room, at 7 o'clock at night, to a woman living there with her husband in bed, and the room would be dark. And as soon as he would come in the door with his old-timey doctor's bag, a light would come on, and the woman would smile. Still in the same condition, still with in bed because she was ill, but just because of that hope of somebody coming in who could help her. It didn't have to be a doctor. And I've applied that more generically just to have the appropriate amount of empathy through my life to know that really the most gratifying things that you do, whether it's business or whether it's a company or whether it's capitalism or whether it's doing heart transplants, is to come back and lift people up in ways to give them hope and give them inspiration. And so that's where it all started. Then I spent those first years there, and then left and went to medical school after that. And I won't go through all of it, but that jump to go to medical school was just a natural extension of being in a family with an older brother who was a doctor, and then a middle brother who was a doctor, and a dad who was a physician. And just seeing the fulfillment that each of them got in being, and it didn't have to be a doctor, it could be a nurse, it could be a healthcare provider of any sort, but seeing the gratification that they would get intrinsically by lifting people up and addressing the needs in a holistic way that other people had. So those images of going on around with that doctor's bag is vivid with me, even today.
That's a story. I've told you this before. That's a story that sticks with me as it relates to how we think about how primary care will exist in the future in this country. And I want to come back to that topic. But before we do, before we get to that topic, you spent the early part of your career practicing medicine. And I know you stuck with that, meaning that even when you moved on to other parts of your career, you continued to practice medicine along the way. I think to stay grounded to your roots. What was it? Or was there a moment, Senator, where you thought, I'm going to move from the day-to-day care of individuals to trying to impact larger populations, either via public policy or First Cressy and venture that sticks out to you as the reason you made that leap?
Yeah, no, there wasn't a pivotal moment, Raj. I ended up going into, that was internal medicine, private practice, taught at Vanderbilt. I ended up going into surgery, and I gravitated to the innovative field. At the time, you mentioned the heart and lung transplants. Lung transplants had never been done when I started. Heart transplants have been started, but after a flurry in the 1960s, very few people were doing them. Dr. Shumway, who I ultimately trained with, was doing about 15 a year, so not a lot. And so for the next 10 years, after I did my training for 10 years, I came back to Vanderbilt, set up the heart transplant program, which, as an aside, is the largest heart transplant program in the world right now. In the world, they do more heart transplants at this program. I say that because I can take no credit. I founded it and put the first 10 years in. The next 25, I had nothing to do with, but very proud of that. But gravitated to the field of innovation, of figuring out how to do a transplant to that people could live 30 years, 40 years, 50 years, when before they hadn't been successful. And got involved in the combined heart-lung transplant, did a lot of academic writing, probably 100 peer-reviewed papers, only because I feel it's really important to document what one is doing. And then I got to where I was doing referrals from all around the world, and I was training people to do these procedures. So that's when my mind started ticking. Well, I can continue doing what I'm doing, but I've already trained a number of people, or I could expand that reach in some way. Would it be running a medical school? Would it be teaching? Would it be policy? I say policy instead of politics, because politics, I'd never run for a public office, never served in a public office, didn't know anybody really in politics when I made that jump. But I did think through, it is a way of extending this one-on-one service, this one-on-one of lifting people up, which I had been given through my hands by doing surgery, and extending it to 100 people or 1,000 people or 10,000 or 1 million or 20 million people. And that's why I made the jump, not knowing anything about it. We were not from a political family at all. And my timing was right. Worked very hard for a year, put in doctor's hours while I was running. And with a lot of luck and a lot of hard work, but mostly luck, made it to the United States Senate. And I started there. Why the Senate? Because I wanted to start at a, why not the mayor or something like that? It was just I was at the top of one profession, and I wanted to make a lateral leap And I had the luxury of not having to sacrifice my principles at all in running, because if I lost, not that big a deal. I could go back and do heart transplants. And your typical political figure, doesn't have that luxury of being able to have a secure position and secure with himself enough. But then jumped into that, and then you don't want to go through all that. And it's a tough business. And I have huge respect for our political and policy figures. But then people ask me, how'd you go from 100th in seniority? Because I never had served in a public office. I was like number 100 out of 100 to the majority leader. And that's part luck, part happenstance. But I think a lot of it was, going back to your very first question, is approaching Washington, D.C. In probably a more humble way, as a physician should, in dealing with patients, with learning to bringing there, being the only physician in the Senate then. There hadn't been a physician in the Senate elected to the Senate since 1928. And so I really think my colleagues elected me to run the body, a non-politician, a non-lawyer with 60 other lawyers, because of that caring background, the background that, Accolade, that same culture of learning how to make a diagnosis with a limited amount of information, being held accountable for that diagnosis, and then following people long term, not just doing something and getting out. And I think that's sort of dealing people with empathy and understanding and looking at things from their side versus the sort of competitive partisanship of politics is why people said, okay, why don't you run this body for the next 4 years?
It's a remarkable story when you think about it in terms of so rapidly going from a freshman senator to a Senate Majority Leader. Boy, I know there's 1,000 questions that people have about politics and the state of politics today, but I'm gonna dodge those for a minute. I just want to point back to, just lay a little foundation before we get into healthcare policy questions, et cetera. Your family story is remarkable. All of the success you've had, your brothers and building Healthcare Corporation of America, the orientation towards service and the orientation towards service at scale, like things like HCA and the work you've done. I think, there's probably there's a lot of parents on this call, and there's a few of them who are wondering what your parents were feeding you guys as you were growing up to build a family that could achieve as much as you had. What do you attribute the ambition and the mission orientation of you and your siblings?
Well, me and my siblings, I was the last of 5. So we were not a competitive group growing up. Dad was really humble. He grew up in Mississippi. He always said he had a little bit of an inferiority complex, but he was very charismatic. When he walked in the room, people would pay attention, but it would be because of trust and his respect as a physician. So saw that. And then so I went through it, and I just kind of floated through, and I didn't know I was going to be a United States Senator. That wasn't my goal in life, nor is it today. And the reason you said I left after 12 years, I knew I was only going to stay there for 12 years. I was just going to occupy the office and serve and get back and live, under the laws that I passed. But in terms of the sort of sibling relationship, very supportive environment coming in, being the last of 5 children. When I had my own kids, I didn't really know exactly how to raise them. I had 3 boys, and they're all doing fantastic. And they each have 3 kids, and now 9 grandchildren. And I read that in the bio that you released. I got 9 grandchildren. They're all under the age of 7 right now. But we did not, my parents didn't ever look at my grades. I just remember going through high school and grammar school, I said, aren't they interested in my grades or how I'm doing? And I guess that was more expectations as a parent. They basically sort of expected me to work hard and do well. And when somebody has expectations of you, they don't really need to be on you. And I'll have to say, I don't ever remember being excessively punished either. I kind of assimilated that in my kids. I didn't ever punish them. I did ask about the grades and that sort of thing. I didn't ever punish them excessively. But I think it really comes down to having really high expectations that you can do anything you want to do. We expect you to be honest. We expect you to be trustworthy. And, I sort of apply that in everything I do now. Instead of over micromanaging teammates in heart surgery or in the Senate or subsequent in private equity, is that expectations. If you lay them out there, people will tend to live up to them.
And it's fascinating the way you lay that out, and the way you, I think you have an opportunity to apply that in your board settings, in the companies that you're actively involved in starting. That there are multiple ways to manage, but the idea of laying out expectations and letting people run to the expectations is
Yeah.
actually, I've never heard you say it that way, but it's very consistent with the way I've seen you behave.
Yeah.
I'm gonna jump back now. We'll jump into some of the healthcare policy questions that I know, or I wouldn't even call them healthcare policy questions. I'd call them healthcare evolution questions. Even before COVID and the last year of the pandemic really having a dramatic impact on the healthcare ecosystem and infrastructure in the United States, there's been an enormous amount of investment, and that investment really looking at, specifically in areas like primary care and behavioral health, the accessibility problem, the availability problem in some of the more in communities that really need it the most, and leveraging technology to be able to solve those problems, and yet acknowledging that there's an element of medicine that will always require physicians to put their hands on their patients and work with them to help them heal. You've been, I think you were on the Teladoc board 10, 11 years ago with the very early stages of that company. And you've also been, tightly tied to companies that are moving into at-home based care and taking care of people where they'd like to be taken care of in their home. My question really is, as you look ahead to the next 3 to 4 years, specifically in the areas of primary care, how do you see primary care evolving? And along those lines, I'm very curious as to how you see disruptive companies like Accolade playing a role in enabling the right type of care delivery in a future model that might be both virtual and physical.
I think that I've always viewed it, because I start with this whole image of primary care being the caregiver and the patient without an insurance company and coming in between, without technology and filling out an electronic health record manually and focusing on a computer instead of the patient. So that vision is to come back. Just a real quick story. Back when I was 10 years old, my dad in the middle of the night would wake up 2 times, at least 4 days a week, 4 nights a week in the middle of the night. The telephone would ring. He would take the old timey telephones. He would take that telephone out. He would put it in this big box, bigger than sort of, about a quarter the size of a desk. And then out of that, you'd get a tape and it would be a reading of an EKG. And then he would do it, and then he would look at it, and he'd pick up the telephone and call the person back. And that person might be a nurse, it might just be sort of an ancillary personnel, but somebody had a heart attack or had chest pain in a little hospital 250 miles away, and Dad was a cardiologist. But that technology, that telemedicine, that telehealth, and again, this was like in the 1960s, coming in, stuck in my mind in terms of how we move. So he was doing telemedicine, he was doing remote monitoring, and somebody in a little tiny rural health town where there are no doctors and there are no cardiologists, there weren't that many cardiologists back then at the time. And that stuck in my mind of how you bridge. It took him talking to the patient, talking to the person afterwards with that interpretation and that use of technology. And that is sort of primary care in its essence, advanced care, but using technology to extend what you could otherwise doing. And that's why you're right. I've been talking virtual healthcare and telemedicine, telehealth for 13, 14 years. When I was in the Senate 18 years ago, I was very involved in Native American reservations and putting the old T1 lines into that. in order to have access to healthcare. And I'd go on these reservations, and I'd go back to the Senate, and I would try to get increased funding for these particular T1 lines. And then, so today, the Accolade and what we're doing with the sort of virtual space to take the primary care doctor, limited by being by themselves, limited about the amount of information in their head historically, and opening it up to where that primary care can do a lot more along the lines of what they used to have to do referrals for, to more specialized care. And that's good for the specialists. I put on my heart transplant and my heart surgery and oncologic surgery hat to have patients come to me who've already gone through the various algorithms, teed up with the right information for the right operation. It makes my time used a lot more efficiently. This increased digitization is moving us in that area aggressively. And a company like Accolade, who is really focused on technology, that's why I think we can be distinguished from everybody else in this sort of reaching out navigation, moving into the primary care and the advanced primary care world. So to me, all this is extension from the past coming forward, empowered by parallel computing and supercomputing and our familiarity with digitization coming forward. And that's what's so exciting to me about where we are today and where we're positioned as a company. Accolade has been a part of my vision, for the last 10 years, Teladoc for the last 10 years. I do Smile Direct in terms of virtual orthodontics care. It's a disruptive technology. Just so much can be done virtually if we have the appropriate connection to the human aspect, the empathy, and not sympathy, but the empathy and the understanding with that digital world, which has the efficiency, the reduction in administrative costs, the removal of barriers between the person in need or the patient and the physician or the caregiver themselves.
It is a uniquely exciting time right now, in that it seems like a lot of the doors that might have, I wouldn't say we're blocking innovation, but might have been friction points for innovation, have in some ways, by the events of the last year, opened up. And talking about, and I wouldn't call this politics per se, but as much as I would call this public policy. We spend a lot of time talking about the differences between the left and the right. And I think one of the things that I most respect about you is your capacity to point out all of the areas where there's mass agreement, where there's mass alignment. And I think when you look at healthcare public policy, whether that's value-based care or transparency, there is mass alignment. There is a lot of, and I watch a lot of your blog posts and the work you do with your Second Opinion podcast, and I see you pointing to those aligning trends that don't have anything to do with left and right, but have to do with public policy aligning around the right things happening in healthcare. Can you talk a little bit about the things you're most excited about in that regard?
Yeah, there is so much. The policy world is really interesting. So what I do every 10 years of my life, I end up doing something a little bit different. So I'm a big believer in change. That on the outside looks like a lot of change, but underneath it, you got this sort of underlying sort of star that you're going towards, and maybe patient service, which mine ends up being, that in some way. But those first 10 years, I did the training to be a doctor, then 10 years actually being a heart transplant surgeon, then 10, 12 years in the Senate, and then 12 years in private equity, and now I'm doing the venture capital thing. I think that change is sort of in there, but whether it's politics or policy, to have a rudder that you come back to, the politics is a way to affect policy. It's a necessary ingredient to policy, and it's dirty, it's hard, it's, you get tempted to compromise yourself all the time. It's a learning curve coming in. The policy itself, you need to have the image itself. And my image is that we're going from a legacy system healthcare world with administrative cost of 30% additional waste, and that we, through technology and digitization, can lower that probably to 5%, which when you're talking about $3.3 trillion, and you're going from 30% to 5%, you got 25% of unnecessary waste. We say waste, it's probably not all wasted, but most of it is unnecessary. So to use the digital world and technology to get rid of that waste or that excess overall, to take that money and plow it back into what really matters, and that is the patient in need and the providers, and they can be virtual as well, the providers as well, to get that connectivity down. So if that's sort of your journey map coming through, policy changes, President Obama. So I've worked with President Bush, Clinton, and it was 6 years with Bush, 6 years with Clinton. No, President Obama, of course, did not work with President Trump at all, but no President Biden really well. And it'll go back and forth. A lot of the things we're seeing now in policy are to improve access, and that's very, very important. You got cost, you got access, you got quality, you got outcome. The access issue that is really important, and I think Biden's doing a lot of good things there, making it more accessible, more affordable. Obama did a lot with the Affordable Care Act in terms of access, and that's good, but it misses the fact we got a broken system. And so you put more money in, and you put more money in the system, but you're not improving where Accolade is, and that is the system itself, the patient, the individual, the prospective patient, the worry, the anxiety with the caregiver. None of that is all the policy of the big public policy that has been done in the last 20 years. It misses it. And that's why it's important to have the private sector addressing these. Not that access is not important, it's critically important. And I think, everybody should have affordable access to care, but it does nothing to fixing the system. And that's where the digital, the advanced primary care, or the equipping people with the appropriate tools, from electronic health records to more virtual care, to the devices that we will all soon be carrying, and some are carrying and some are implantable or not. That's where the excitement is. And that's why capitalism is important. That's why the teamwork's important. And so the policy is critically important. It sets the framework. You have to have the appropriate funding. You have to have structures like the Affordable Care Act and Medicare and Medicaid. Those things can't be done without the policy. But the actual engine and the dynamism and the efficiency are going to have to come from companies like Accolade going forward.
Yeah, that makes perfect sense. It is really interesting when you really start to find yourself in the machine of healthcare, that so much of the conversation is about just that access, which is an important conversation, but very little of the broader dialogue that you see on the front page of the newspapers, or if newspapers is not an outdated reference, or that you see on TV, isn't about that, or is about that, but not about sort of how do you fix the internals of what really needs to get fixed inside of healthcare. I couldn't agree with you more. I'm going to now open it up, sir. We're 30 minutes in, and we've got a growing list of questions, and they're spanning a number of topics. So to the rest of the audience, if you haven't put your question in chat, please do. We definitely want to hear from you. The questions span a number of topics, and so we're going to start with family, if you don't mind, and then we'll jump to some of the questions around healthcare policy. The first one around family is an interesting question, because we've got so many working parents in the group, and I'll maybe give you I'll tie two questions from two different people together. The first question is, how have you managed with all that you've worked on and achieved, and how busy you are, to maintain your sense of work-life balance? It's a question that all of our speakers get, by the way. And secondly, have your boys inherited that sort of public, I wouldn't call it, have your boys followed in your footsteps from a healthcare perspective, and are they really interested in the same things and helping people? So those are the two, and I've woven together two questions.
And the work-life balance is it's really interesting that times are very different now. So where for the 10 years, one of the 10-year block that I was a resident, a medical school resident, fellow, training goes on and on. There's actually 11 years of training. I was working 18 hours a day, and I was working 7 days a week. And that was the way it was done then. And the more cases I could do, the better surgeon I was going to be. And work-life balance was miserable. It was terrible. And and literally 18 hours a day. And that went on for about 5 years solid. So terrible there. As I went through before and started having children, so and the sort of the family interaction sort of adapts with the time. Then when I had children, made a huge point, because during that period I got to Washington, D.C. Then I had 7 million people, not just 3,000 patients calling on me all the time, but I had 7 million people in Tennessee basically saying, we want to touch you, we want to see you, we elected you. And that sort of demand was there. And then when I became majority leader, it became, 250 million people out there wanting things. So I did pretty well. In retrospect, nobody, and you shouldn't feel guilty about it, because nobody does as well as they would like. Jumping ahead to but I made athletic events and school events, and I was on the board of my kids when I was in Washington, as he was majority leader of their high school. So I did my sort of very best there, but never as good as you'd like. My boys, it's very different. The boys did not become physicians. I continued doing, I go around the world operating. And so I operated in 14 different African countries as part of medical mission work, even during my Senate years. And I would take them on those trips. I'd take one boy at a time, one son at a time when they were young. And it had an impact on them. None of them became physicians, but one of them is in a company called Navi Health, which does post-discharge sort of where patients should go. So it's in the healthcare industry. The second one went into the government service in the intelligence world, and now went on to business school, and then now with Ginkgo Bioworks. So also in the health aspect of that with COVID, fantastic synthetic biology. And then the third one is not in healthcare, but he's doing a gasoline startup, and they all went to business school. In each of them, either they're doing something in their life, and I mean, Accolade's a company, you're doing something, helping people every single day. But most businesses are not that way. And the ones who are not in healthcare have a nonprofit or a philanthropic focus at some time. Even though they've got their family and they've got their job, they've adopted a nonprofit company or a nonprofit entity. I think it's important. Even right now, I'm still working hard all the time. Even right now, I get a philanthropic entity. I do the Robert Wood Johnson Foundation, and I do the Nature Conservancy, where I can address climate change, the intersection of health and nature, and which is really important to me, even more important in these trying times. So I think this sort of having, if you're not in a job doing something, having some sort of philanthropic work that can give you that sort of mission satisfaction that you're leaving this world a little bit better than the way you found it.
That's you mentioned you were kind enough to participate in our Accolade commencement ceremony back in June of last year, when the pandemic took graduation ceremonies away from a lot of graduating seniors. And you mentioned your commitment to nature and especially at that moment how important it was. Next question, we're gonna jump, and again, I'm gonna combine a couple of questions that go back to primary care and go back to you following your father around when he was doing rounds as a primary care physician. And so part one of the question is, increasingly, and we had acknowledged this fact with an offering called Mental Health Integrated Care, where we tried to blend the behavioral health elements of a person's overall health into their healthcare journey. How, when you were following your father around on those rounds or those calls, he no doubt, as a primary care physician in those timeframes, was factoring in things like behavioral health just by virtue of the way he had built the relationship. But I'm curious as to what you take away from that and how it's supposed to work in today's world.
Yeah, no, it's a great question. What I would see, and remember at that time, this is 1960, we didn't have all the medicines we had today. He had a doctor's bag. He didn't have a CAT scan, an MRI scan, and what the sort of things that we have today to make the diagnosis. He had a stethoscope around, and that's it. So I would say that probably 90% of what he was the busiest primary care doctor in Middle Tennessee. 90% of what he would do in terms of being a physician, being a healer, was behavioral health or mental health. 90%, 90%. And so that sticks with me, and it sticks with me all the way through. One of the bigger companies that I have founded is in the palliative healthcare field, the end of life sort of world. It's called Aspire Health. Founded it maybe 7 years ago. Ended up Anthem owns it now, the last 2 years. But a huge component of that we would find going into the homes over the last year of life was community-based palliative care. Was on the behavioral, the mental health side. Not just facing death, but this chronicity of disease. Most of the people have 3 or 4 chronic diseases by the time that they die. And so there, the whole orientation was around behavioral and mental health. From an investment standpoint today, Teladoc, if you look at the growth in Teladoc, which has been phenomenal in the last year in virtual healthcare, about 78, 79% of all of that growth over the last year has been in behavioral health. It's been a lot of phone calls coming in, but the true growth has been in behavioral health. The stigma has been removed. People are reaching out more, and now we're beginning to develop the facilities for it. In the investment world right now, I've got about 12 active companies in the venture world. One of the most amazing and most gratifying is in the substance use space, the whole world of addiction to narcotics and to other types of addictions as well. And Spero Health, Spero Health, we're now in 55 communities, mainly in the South, and we'll go to 70 communities. The technology using right now, for being able to prescribe certain drugs for people who happen to be addicted to narcotics. Right now, you have to have special doctors writing special prescriptions. Should that be totally virtual right now, instead of having to go to a bricks and mortar where there's still a stigma of you're walking into a door itself? So it's explosive growth. Now, increasingly over the last 3 years, we're seeing people set up, whether it's at the Vanderbilts of the world or the companies like Spero, or where the virtual health MATS type distribution, an appropriate focus on mental and health. Just lastly, how does this policy stuff work? There was a Mental Health Parity Act started by Pete Domenici and a guy, Paul Wellstone from Minnesota, 25 years ago. And we never could get mental health parity, true parity of where money spent by our government will be this much for physical health and this much for mental health. Mental health was always the stepchild. And even today, we call it mental health parity, but we don't give appropriate reimbursement by commercial payers or our government for mental health and behavioral health.
Yeah, yeah. So giving some credit to the questions, that there was Maria in there, Annie Brockway, Sandra Jimenez. I'm gonna just so the folks know whose questions I'm asking. The next one I'm gonna paraphrase again. It's from Kelly Thrasher, and I know you have a ton of passion around, particularly given where you grew up and the work your father did, around rural communities who don't have access to the care that they need. And that same thing is true, not just in rural communities, but inner city communities, that there are significant inequities in healthcare in the United States, and the access to that for those communities, oftentimes economically disadvantaged communities that don't have access to the care that they need. And I know you're doing some work in the rural communities that I think the team would love to hear about, but also generally speaking, what combination of changes in policy / innovation need to occur in order to really address that problem directly?
Yeah, the one thing that COVID has done, we talked a little bit about the explosion, and talked specifically about COVID, but we've seen this explosion in virtual care, in part because our government policy matters. We got to vote. We got to get out. We can't walk away from it, because we elected people who did react immediately and lowered the requirements around telemedicine, telehealth, which was life-saving for thousands, hundreds of thousands of people over that 6-month period. And it took that sort of reduction in the policies themselves. So rural health So what I was going to say about COVID, so it's uncovered secondly, besides virtual health, is the disparities that we've seen. The disparities of, if you're black or brown, you live in certain areas, you're of a certain age, you are more likely to die of this virus. Even right now, the vaccine hospitalizations and deaths are going up. No, deaths aren't going up, but hospitalizations are going up right now as we speak around America. So this light on disparities. The disparities themselves, one that hasn't been fully addressed now, is rural health. And I live in a rural state. Most of America is rural today. And I don't have any announcements to make today, but over the next 3 years, and I mentioned it to you, Raj, the number one priority you'll see me focus on is rural health. Is that, say, 40% of America who does not have good access to, not just affordable access, any access to the sort of good quality of healthcare that they deserve. So how do you reach them? Number one, there are a lot of companies starting just from telemedicine, telehealth, and that's good, but it's not going to work. It's a huge benefit, a huge advantage, because it doesn't have to be video like we're doing now even. It can be just a telephone, or increasingly by text like it has in mental and behavioral health. It's explosively effective coming in. But the cultural aspects of what we do, and again, Accolade is so good at this and adjusting for everybody you're talking to or writing to or interacting to or emailing or texting, is figuring out the cultural aspect. And it is very different. And things like hillbilly elegy and sort of this recent popular people being so surprised by all that, that is just the way 30 to 40% of Americans live. And so what I'm going to do is address it, have a huge virtual component to it. Go to the payers right now who are getting money through Medicaid, Medicaid, and commercial payers, being responsible for people, but they don't culturally know how to reach them. So the best model is going to be a hybrid model with some bricks and mortar in the communities that are run. That bricks and mortar is going to be run by people of the community. They don't have to be the doctors, because the doctors aren't there. They don't even have to be nurses. They can be caregivers, but they've got to be run with a heavy hybrid component of telemedicine. And it comes down to increased digitization, yes, but also strategic partnerships. The partnerships are not necessarily with just the big payers, which they have to be, but with the community themselves. Connectivity, probably the single most important thing we can do right now is connectivity, in terms of having some sort of communication, internet, even telephone line access increasingly going forward. So I'm really excited about it. Again, forget everything we've talked about today, but call me on it in about 24 months and say, how successful have you been? But I'll tell you, that's where I'm going to put a huge chunk of my focus going forward.
It's I think it's a really important, I think we're going to see more, and we're already starting to see it in some areas. Companies like Oak Street Health really focusing on those populations and trying to figure out different ways to do that. And I think for them, as you mentioned, really focused on the Medicaid population or the dual eligible population and in those communities. And the more we see innovation in those places, what I think is particularly compelling, like what you're talking about or what any of these companies are talking about, is we're seeing private sector innovation driving value and hopefully driving it at scale in a way that can really help people. Next question just gives you an indication of how much the people at the company follow you. It's from Jen. She read your Facebook post, she read your blog post around how Facebook can improve your health, talking about social biomarkers. And really, I think we talk about social determinants of health. And I think you took it to another level when you talk about how we can use social media to really focus or to monitor and promote sort of community learning. So you talked about partnership with the community as it relates to how we're going to deal with some of these access to care issues and the quality of care issues. Can you expound a little bit around what you mean by social biomarkers and how that can be used to make healthcare work for people?
Yeah, and the social media aspect. So I get involved in social media a lot, and I do it, but then I did in the political world as well, looking always for the positive aspects of it, and then also address both from a policy standpoint, things like the privacy issues, which are really threatening to us and continue to be threatening to us, and sort of the Facebook in the broader social media story with the aggregation of data and data that could be used against us. And even if these companies aren't, and they may be, but other bad actors that that I've been exposed to because of my policy world and the clearances that I've had in the past, bad actors want that sort of information. On the positive side, if we say that sort of one of the COVID had this sort of effect on virtualization of healthcare. And the second biggest thing is probably on this whole social determinants area. And the social determinants areas, I don't even use the word anymore, Raj, I call it non-medical determinants, the sort of other things in life besides a doctor or a prescription or a hospital or an operation affect us. And the social media today is the best that can do what I did when I take somebody's pulse or when I take somebody's blood pressure. The social media picks up in the moment where people are. You pick up where they project to be, where they want other people to see them, but also where they are. And that sort of information, especially in the mental health, when I spend a lot of time in the world of suicide in terms of studying it and getting involved in activities with it. And I did from a policy standpoint before. But what can be picked up, and that doesn't mean Facebook needs to be picking it up. It needs to be identified to pick up these trends that are going forward of pressure, of intensity, of people's reaction to it, and then intervening appropriately. And just even talking about it, you see that you're in these sort of fine lines of the privacy and the sort of big brother aspect to actually the healing and the curative and the growing and the sort of the constructive, the anabolic versus the catabolic coming in. And this aggregation of data and how it's handled. And that's why policy is important. We need to address these things in advance. And just closing on that, things like the genomics revolution, transformation. I mentioned my son's working with Ginkgo, which does a lot in the genomics world. I think all of these discussions, and we're not there yet, have to begin. Every hour of a discussion should begin with a discussion of ethics, of responsibility, of who should benefit and disparities and who will be left out. And we don't do that. Policymakers don't do it very well. Business, we maybe are a little bit better now than we used to. But I think having this sort of more ethical discussion, and it applies to climate change, which I'm involved with, when I'm talking to Republicans who don't believe in it, and Democrats who do, but don't do anything about it. If you just come back and say, what is the construct? Do we have a utilitarian construct? The greatest good for the greatest number of people, that's good, but I would have never done heart transplants if we were doing that. We just put all the money in vaccines. But anyway, these ethical decision-making upfront or discussions upfront, I think are really, really important as we get into this increasing digital world.
Wow, that's a conversation that we could spend a couple hours on right there, which is who owns that ethical construct and where does that debate transpire? Because man, we could use that debate way more than some of the debates we're hearing today.
I will just say on the right after this, I'm going to do a thing on ESG, the sort of ESG movement around the world, where you're looking at obligations of us, of social responsibility, of sustainability, of our environment, and increasingly both CEOs but also companies are getting involved in these sorts of movements. And it really comes back to what I think is the right thing to start these discussions. Again, I don't want to belabor all that, but it applies to our individual life. When I'm talking to my kids or talking to my grandkids who are all 7 and younger, I'm trying to begin with sort of the big ethical construct first before coming back with, don't do that, or, don't squeeze that chicken after Easter too hard, or that sort of thing.
We talk about a new brand of capitalism at Accolade all the time. The idea that you can build a company under a capitalist construct that does good things for the universe, and that both things are very possible, and that's the new form of capitalism, and that it's the right model, and it's the model that we hope to embrace, that we are embracing here. I've got 2 questions to wrap us, and it's 7 minutes to the hour. And I'll give you a chance to package them up how you like. I think the first is there's a lot of questions from people around how you pick. The Accolade choice 10 years ago was a pretty contrarian idea, and you didn't know. You certainly didn't know that Accolade would be a public company today with opportunity in front of it. And yet you made that choice. You decided to invest your most precious resource of your time in a company like Accolade. And so how you make those choices, how did you know Teladoc was going to be there? How did you know Accolade was going to have some level of success? And how do you make those choices? That's part one. And part two, maybe if you could wrap for us on what's the most exciting part of Accolade's future for you, and what you see in the future for the couple hundred people on the phone or listening in today, and the hundreds who will listen later.
Yeah, I will kind of answer both of those together. My life, I've been blessed to be able to go through these linear sort of 10-year blocks coming through, and then now do a portfolio of things, mainly the venture capital world, and then selectively choose 3 or 4 boards, public company boards, and build companies so that they'll go public, and then these philanthropic boards that I do. And what it comes back to, and it really comes back to sort of the why Accolade. And if Accolade were going to be the same company we thought 11 years ago, or when I came on the board itself, I wouldn't have joined Accolade. The sort of boards that I want is a vision of a journey, and the journey is built around purpose. And the purpose needs to be articulated, I think, early on, because it's the reason behind everything that we do. And it applies in personal life, our professional life, in our careers, but also on a board. And secondly, I choose boards who have good governance, beyond that sort of purpose, and the governance. That's sort of an easy thing to judge coming in. And I've gotten it wrong in the past too. You hear all this stuff. I've made lots of mistakes, and we can go through those. We can talk a lot. Thank you for not talking about all those, but everybody's listening, so it all sounds so good. I made bad mistakes along the way, but I learned from them quickly coming in. And I think so. The purpose end of it, with Accolade, I saw a certain courage, and that courage is the boldness to be able to try things, not just be satisfied with the status quo, try things in a big way. And I think, a lot of the things, even sort of the big pivot we took in terms of you coming in and bringing an unbelievable team in, that's not, that can be risky. You and I've talked about it in the past, but that sort of courage to be able to take those appropriate risks, if it aligns with your purpose. I think the awareness end of things of a company is really, really important. It's not Bill Frist, the heart transplant surgeon who did 150 heart transplants. It is a team that is represented by probably 60 or 70 people who work over those 8 hours of doing a heart transplant. And if one of those 80 people doesn't do their job, those 3 hours where I'm sewing that heart in does not work.
Right.
The outcome is not there. So I think that awareness, the sort of other thing I think Accolade does well that I generically use is this whole sense of inclusion. And that really, now we'll say, well, it's the diversity, it's the inclusion, it's the sort of things that we're talking a lot more about than we did a year ago, not just because of George Floyd, but it's COVID, it's just with the times. And I think this inclusion applies to empathy, to understanding, to the diversity in the boardroom, and bringing people to the table to sort of capture the diversity, not just racial diversity, which people think about, but the diversity of ideas and socioeconomic background that is captured. And then I guess a third thing, and these are the same kind of things that I use to find CEOs to put into companies. And when I started a lot of companies, is sort of this thinking in an assimilating way, integrative sort of thinking, not being so narrow in the thinking, but allowing the quiet person in the room to speak. And when they speak, you find out that they are the ones who've got it going, and to be able to integrate it. And this applies in the United States Senate. When I went in the room, I didn't find people doing a lot of integrated thinking. I didn't see people with the diversity of seeing a doctor there, the doctor that knows about writing prescriptions. So those are the sort of principles that start with purpose, I think, and filter on down to this awareness and this inclusion and this integrated thinking and this sort of courage. If I had to kind of put things in buckets, that's where I would put it. And that's what we got. So you want to have change over time. I'm right now, I've been trying to lose some weight because I gained some weight on COVID and I've been pretty good at it. But what's worked for me is doing this intermittent fasting. And as I'm doing it for 16 hours a day, fasting and eating for 8 hours, which is good literature on now, good science. I used to be very skeptical, and 3 meals a day I'd have to eat, or 4 meals. But what happens is the cells are working, and then when you fast them, they turn off, and then they become sensitive. And when they come back, they work better as machinery. And I think that applies to all of us in terms of change as well. So that change over time built around those sort of principles, to me, are what make Accolade so exciting, but also are probably good principles to use when you're deciding whether to join a board or to pick a CEO, or how you apply to yourself in terms of the jobs you do around the house and taking care of kids and raising a family.
Senator, we've first of all, thank you for the inspirational answer. I think everyone who didn't know you before knows, has a little bit more insight now as to why we're also excited to work with you. We can't thank you enough for being here. We definitely, for those of you who have been on or who will listen in later, we want your feedback. And so there's a survey, a little barcode popping up that we want you to dig in on there. Our next speaker, after we thank Senator Frist, our next speaker, we've been all Nashville all the time. We did Cindy Kent last month, Senator Frist this month. Our next speaker will be Dana Udall. She's the Chief Clinical Officer at Ginger. It's Mental Health Awareness Month next month, and there's nobody better than Dana to join Shantanu, who will be doing the interviewing next month. And we really want you to be there as well. Senator Frist, we can't thank you enough, sir. It means the world of us that you would spend all this time educating us, spending time with us.
Thank you so much. I'm honored.